2 weeks ago, Pennsylvania's Department of Health released data from a vaccine survey that was sent to every nursing home throughout the Commonwealth. You probably saw that release. The purpose of that survey was to measure COVID-19 vaccine acceptance rates among both staff and residents and gauge what the continuing need might be at the epicenter of the COVID-19 pandemic. The day before the state's data was published, we at the Pennsylvania Healthcare Association, or PHCA, released the results of our own survey, in which 83 of our 400 members, including nursing homes, personal care homes, and assisted living communities, responded. Our results were very encouraging in terms of the vaccine acceptance rates. Yet, what was very alarming to us was the fact that 5% of frontline workers and residents had not yet had the opportunity to even receive the vaccine. In other words, we determined that there was still a need. And since mid-December, we've called for a plan to ensure that our vulnerable residents and staff can have access to the vaccine at their facilities or in their communities on a continuing basis. Vaccinations should not end when the Federal Pharmacy Partnership Program ends. 2 weeks ago, as we looked past our internal data and then analyzed the state's results, it became very apparent to us that there were, unfortunately, data discrepancies. As of April 15th, in that survey, 32 nursing homes on the state's list showed that their workers' acceptance rates, in addition to their declination rates, added up to well over 100%. In some cases, added up to 400%. Additionally, 67 nursing homes showed resident acceptance and declination numbers that exceeded their actual census. In other words, more residents had accepted or declined the vaccine than the number of actual residents in the facility. This is not the first time during the pandemic that our association has had to address inaccurate data reporting. In May 2020, when the first COVID-19 case counts were being published, PHCA went as far as to threaten legal action because the data was so flawed. And since the very first cases of COVID-19 were confirmed in Pennsylvania, and as providers were forced to restrict visitation for family members and for loved ones, our membership has supported transparency. We've supported the public reporting of data. But what good is transparency if the published results are inaccurate? Moving forward, we have encouraged our members to contact the Department of Health if corrections to their data must be made. And today we are encouraging other providers outside of our association to do the same. Ultimately, who is hurt by this inaccurate data? It's those family members. It's those friends, those loved ones who were told one thing by an administrator or by a caregiver, but then see quite another when the state publicly reports. We saw it in May 2020, and we're seeing it yet again almost 1 year later. We've also learned that our providers found a lack of clarity in the questions that were being asked in that survey. The Department of Health recognizes now that some providers entered cumulative data versus other providers who were entering current data. And we believe this is one of the causes for data discrepancy. With the state's plan to continue these surveys, potentially even on a quarterly basis, we welcome collaboration with the Department of Health and state leaders to share feedback and improve the survey to ensure that the most accurate data is being shared with the public. Again, PHCA supports this reporting as long as it's done right. Now, no matter which data we've analyzed, it has become abundantly clear, both here in Pennsylvania and really throughout the country, that we are not seeing 100% vaccination rates among workers and residents. And we may never see that. But we shouldn't discredit those who have remained on the front lines of the pandemic, nor should we cast immediate judgment on those who have or haven't received the vaccine. In the 2 weeks since our results have been published, PHCA has worked with our members throughout the state to learn why acceptance rates are hovering among 55 to 60% among staff, and if there are indeed ways for our association and for our leaders in state government to further help educate and inform on the vaccine. 2 weeks ago, there were headlines that painted a picture of selfish, uninformed nursing home workers who refused to take the COVID-19 vaccine. But what we learned by speaking with providers is that the reasoning for hesitation or even apprehension as it relates to the vaccine is not that simple. I'd like to share with you the feedback that we've received from providers as to why some of their staff have chosen not to be vaccinated thus far. First, there was interest in receiving just one shot versus 2 shots. So many workers were waiting to have access to the J&J vaccine, and this was before the pause in administering that vaccine. Some providers were dealing with outbreaks at their facilities, and workers tested positive for COVID-19. Not only could this have caused them to miss one of the 3 scheduled federal clinics, but it was shared with us that primary care physicians were now advising patients to wait 90 days if they had tested positive before going to get the vaccine. Nationally, about 92% of the workforce in long-term care is female, and 65% are between the ages of 16 and 44. Rumors of infertility because of the vaccine continue to linger among staff. Providers have also shared that they saw many women in healthcare delay family planning during the pandemic, and those same women are now hoping and looking forward to continue that planning after the pandemic subsides. Some workers are currently pregnant and were advised not to get the vaccine by primary care physicians. We're also hearing about a distrust in our government, which results in a lack of trust in the vaccine. We're also seeing a historical distrust in medicine, particularly within communities of color, especially historical distrust surrounding treatments that are at the experimental level. And we continued to hear that the vaccine was just too new and that workers or residents did not want to be the first to receive it. Today, to shed some more light on this, we are very proud to be joined by Kathy Derleth, the Chief Nursing Officer of Bedrock Care, a PHCA member. Kathy has really led the charge for her facilities in providing education for her staff. And I'd like to turn it over to Kathy to share with us what this vaccination rollout has looked like among staff and residents at Bedrock and how she has approached education and outreach for the vaccine. Kathy, I'll turn it over to you.
Good morning, and thank you, Zach and Pennsylvania Healthcare Association for this opportunity. As Zach said, my name is Kathy Derleth, and I am the Chief Nursing Officer at Bedrock Care. We're an 8-facility long-term care company that services about 1,500 staff members, and they care for around 1,300 residents on an average daily basis. This includes everything from short-term, long-term, rehabilitative, and hospice care. We care for dialysis patients and those with multiple chronic medical conditions. These groups are all part of a vulnerable population, and we take their care very seriously. I appreciate the opportunity to share with you some information around the COVID-19 vaccine strategy as it related to our facilities in light of the data recently released by the Department of Health. In a transparent effort to share information, we are doing our part to report to not just 1, not 2, but actually 5 different agencies throughout the pandemic, all requesting data in different ways and reflecting different time periods. This is in addition to federal and state guidance that was changing almost daily, if not sometimes multiple times in a day. We have also upheld our responsibilities in completing surveys, such as this vaccine survey. To do our part in protecting these residing and working in long-term care, our family members and those in the surrounding community We needed to receive the vaccine before any survey was even relevant to begin. It was no surprise in mid-December that excitement really began to build as we heard the buzz that a vaccine had been approved for emergency authorization. Before Christmas, I began planning for intensive education, information sharing, and facility clinics because with the vaccine in our facilities. We actually were informed our first clinic was scheduled to be held on January 2nd of 2021, just 2 short weeks post-approval. Yet as hopeful as we were, once the authorizations were approved, we were told our future opportunity to obtain the vaccine may be limited to our initial clinics. Our facility leaders quickly attempted to reach as many staff as possible. Most were provided with 3 dates for the clinics: dose 1, dose 2, and then a makeup day for those who may have missed a previous clinic. It was time for a full court press to understand the vaccines, their cautions, the side effects, the indications for use, and just like the antibody treatments some received, we knew that the vaccine provided another level of protection for our staff, residents, and our communities at large. At that time, we were being asked to be the pioneers to do our part to eradicate COVID-19. We really looked forward to a time in the future when our residents could once again have group activities, communal dining, roam throughout their home, and hug their families. We hope for a day to lessen the tight restrictions that went into place in the beginning of March 2020. So we went to work. We developed a 4-prong vaccine strategy. This plan addressed the various cultural diverse facilities that were located in both rural and urban communities. This addressed staff with varying health and comorbidities. Some may have even had parental living arrangements or multifamily living arrangements that they had to consider. And many were without access to factual information about the vaccines. Last but not least, understanding the historical distrust of our government, particularly, as Zach said, as it relates to the experimental treatments. So let me review quickly what some of our strategy included. First, we led by example. We ensured that at both the corporate and the facility leadership level, a positive culture about the vaccine occurred and remains in place to this day. Our leaders were the first to sign up. Next, we educated and informed staff. We approached this through virtual vaccine webinars. We displayed CDC brochures, posters. We continued with guidance. We supported early with assisting with the vaccine paperwork to take the burden and heavy load off of the facility for all the documents needed. We had Q&A sessions. We had town halls and Facebook live chat sessions. Our medical directors actually hosted many Q&As throughout various different shifts and time of day. We also celebrated the vaccine clinics and began to track our progress. That generated excitement and activity. We had a corporate cheerleader that went to each of the homes on day of the clinics and just generated excitement around the vaccine, hearing the stories of why certain individuals chose to take the vaccine. She encourages staff and maintains the one-to-one discussions with those who were hesitant. We shared those vaccination rates throughout the facilities and set goals to achieve. We discussed them routinely across many company forums. We celebrated the experience, the passion that some staff felt regarding the vaccination. We handed out stickers, t-shirts, certifications, and made sure that their photo were posted to show that they were doing their part. Last but not least, external promotion and communication. We participated in news interviews, not only to promote the vaccine within our own communities, but as a responsibility to promote it in the greater community. We recently highlighted celebrity influence on and offline to promote vaccine administration. But the reality is, this is still a very personal decision. For some, it's being informed by medical, religious, or cultural leaders and resources outside of our community. Although we did not meet our original goal of 80% of resident and staff receiving the vaccine, contrary to the Department of Health's data, we did achieve 70% of residents and 51% of staff. That should not be overlooked or discredited. Knowing there was room for improvement, however, we went back and reevaluated. We provided re-education, information sharing. We partnered with the local regional congregate care assistant team. We shared new data, the research. We held more open forums, revisited the success rates, and talked about the survey outcomes. We also sent individual surveys to each of our staff members that anonymously they could raise any questions or concerns that they had. There are many reasons staff and families may have chosen not to receive the vaccine, many of which have already been addressed. There is more to the story than what the data has told, and I'm here to share that we have remained committed to providing education and current information to help inform decisions for those in our community. The Department of Health numbers reflect only a specific point in time, a time when information and testing of the vaccine seemed very new and scary. Many only knew of troubling internet theories and fear of severe allergic reactions. The point in time, the survey also needed to consider the continuation of residents and workers that transition into and out of the long-term care, especially after the initial clinics ended, not having the opportunity to be offered again the vaccine. Many staff have watched and continue to see that vaccine safety is being closely monitored. They see their coworkers and residents take the vaccine with minimal to no side effects. Many are now stating that when this next opportunity arrives, they will consider being among those who get vaccinated. This is why having a plan for continued vaccination was so very important. As we move further into 2021, I know that our educational outreach will continue, but we can use help. Support from community groups to advance education efforts that help us overcome some of the barriers and further build vaccine trust among workers and residents and families. I appreciate the opportunity to share the other side of the vaccine story. Thank you, Zach.
Thank you, Kathy. And I want to echo something that Kathy has said here today. We here at PHCA believe that since our workers and our residents are members of the community, that we can call on community groups, community leaders who can support our initiative for higher vaccination rates. So today we're looking for partners. We're looking for those who want to collaborate and help us identify areas in which providers like Kathy can improve their outreach and overcome these barriers. Thank you, everyone.
Thank you, Zach. Thank you, Kathy. I will move on to the Q&A section of this media availability. The chat box is open. If you'd like to submit questions, please include your name and media outlet so we can share that with Zach and Kathy when we ask the question. Zach, Kathy, our first question comes from Flora Pastorero with PennWatch. Flora is hearing from friends who have loved ones vaccinated in nursing homes that they still can't visit with their loved one. Can you speak to that as to why they might not be able to see their loved one at this point if they're vaccinated?
Yeah, thanks, Eric. Let me take that one. And Flora, thank you for your question. We have heard about those examples throughout the state as well, why visitation wouldn't be occurring right now.
Ensure the vaccine roll out.
Hey, one of the things that we've seen is that if there is an outbreak, according to guidance, that facility has to end visitation until there's a complete round of testing that's been conducted. And I just want to make sure everyone understands that an outbreak in Pennsylvania is deemed as one resident or one staff member testing positive. There are a few other scenarios that would mean suspending visitation as well. Those would be that the resident in question has tested positive, that resident is in a unit that is quarantining because of a positive case, that facility is still waiting for test results, and that facility is in a county where the positivity rate is 10% or higher and less than 70% of all residents have been vaccinated. And I think it's important to note that as of Monday's most recent data report, there are now 21 counties throughout Pennsylvania that are reporting 10% positivity rates or higher. Kathy, anything to add for that?
Thank you. Sorry about that, Zach. Yes, thank you very much for that question. Just as Zach mentioned, there's so many variables to make sure you're evaluating. And as a reminder for that as well, depending on the number of residents moving in and out, new staff starting, going, the county positivity rate is looked at and monitored each week, as well as if anyone even, exposures. However, compassionate care visits and things like that have been and always remain, but it would probably be an individual company process of how they're going about evaluating it.
Thank you both. Our next question comes from Jimmy Martinez with Spotlight PA. Jimmy asks, what do facilities need moving forward to ensure the vaccine rollout continues smoothly? Anything that needs to change or be corrected?
Kathy, why don't I start with this? And Jamie, thank you again for your question as well. I think we've talked about the importance of a plan today, and that plan was presented by the Department of Health 2 weeks ago. And what we've called for since the beginning of the vaccine rollout, mid-December, for long-term care, is that both residents and workers need to be able to receive the vaccine as efficiently and as easily as possible. And unfortunately, we've seen that hasn't been able to happen throughout the last few months and even throughout the last few weeks. It's why we've called on the state to partner with the tried and true pharmacy partnerships that exist here in Pennsylvania. Many facilities, many providers, including Bedrock and Kathy, have those existing relationships. So let's make sure our long-term care pharmacies have access to the vaccine, can receive the vaccine, and then can bring the vaccine to our residents and staff. I also think it's important to note, we talk about the importance of mass vaccination clinics and community clinics throughout Pennsylvania. And that's all well and good for members of our community. But for residents, especially in nursing homes, it's not easy to transport. It's not easy to bring those folks to a mass vaccine clinic. We need the vaccine readily available to be able to be transported to our facilities so that we can ensure continued vaccination rates. Kathy, would you want to add anything to that?
Actually, Zach, you wrapped it up very well. I think that, again, from the educational and ongoing support, as we mentioned earlier, to make sure you are correct, it is not easy for residents to be transported out to these mass clinics. We also have short-term residents that need assistive chairs, wheelchairs. They can't sit and stand for long periods of time. So the mass clinics do not work for those. We need the continued support from the pharmacy programs to be able to get it and get it quickly and make sure that it's an ongoing fulfillment as we do transition residents in and out, not just for long-term care, but also for rehabilitative care as well.
Thank you. Our next question comes from Sean Hamill. Sean Hamill with the Pittsburgh Post-Gazette. Kathy, this is for you. Is Bedrock considering requiring vaccination for staff? If so, when? If not, why?
Great question. Thank you, Sean. We are not at this current time. And for mostly a lot of the reasons that have already been discussed here today. There are a lot of different scenarios, living arrangements, as well as medical life choices. It is a freedom of choice to do it. However, we want to do whatever we can to help and eradicate COVID-19, but it may not be at this moment someone is wanting it and taking it, but it will be perhaps in the future and ongoing. And I think that's the important takeaway at this point. So we are not requiring it for our staff members. It is an optional at this time because there are personal and multi-pronged reasons people have not taken it.
Thank you, Kathy. I apologize for the delay. I'm having some technical issues on my end. Our next question, we're going to stick with Sean Hamill from the Pittsburgh Post-Gazette. Zach, this question is for you. Sean says, I read the survey DOH put out. It seemed pretty straightforward to me. What part of the question about vaccination numbers seemed confusing to facilities?
Thanks, Sean. I'd go back to what Kathy said earlier and really how she began her remarks, talking about the different databases, the different information that needs to be inputted on a daily or weekly basis for both state and federal government. Given the multiple reporting requirements that are currently in place, many of our members read these questions as asking for cumulative information versus the real-time information, whether it was that day or that week. I think it's also important to note that we raised that concern with the Department of Health, and the department did acknowledge that there was a lack of clarity in the survey as it relates to real-time versus cumulative data, and they're allowing for that information to be updated. And I would go back to something that I said earlier in my remarks too, as we look to do this moving forward, as we look to do it potentially on a quarterly basis and report this information to family members, to loved ones, to friends, we need the questions to be as simple and as easy to understand as possible for providers so that we're not having these data discrepancies moving forward.
Thank you, Zach. I thought there was another question. Stand by. Sean also asks, Zach and Kathy, you have both cited the need for additional clinics at facilities, but getting vaccines now in most parts of the state is relatively easy to do through the abundance of outlets. I understand why residents might need to be vaccinated in-house depending on their physical abilities, but why aren't staff who have now considered getting vaccinated going to get vaccinated on their own?
Kathy, do you want to address that first?
Survey doesn't, I'm sorry. The survey itself, Sean, thank you for your question, does not really reflect the ongoing status with staff. There were many staff members as we have begun our survey, again, that re-education and looking at how we could continue to improve. We found that some staff members had received it in the local communities at some of these larger mass clinics. And again, documentation for that, it wasn't always remembered to be brought in or handed over to us to view. So there is a lot of staff as well that have received it outside in the community. Additionally, just today, we became aware we are going to have additional doses of vaccine just throughout this next week. And we have a number of almost 400 residents and staff that have signed up to get this second round of clinics as well. So as time has gone on, you know, the safety factor, I think, and the concerns about how quick it was literally 2 weeks after approval when we had our clinics, it was just so new.
Kathy, to stay with you, Sean's follow-up is, does Rock require any current vaccinations as a condition of employment?
So there is evaluation of tuberculosis status, hepatitis B, but they do also as well if there is declinations. There's a lot of reasons, as we've mentioned already, religious beliefs, medical or physical, that can be done. But that is the current at this point in time. We do test all new employees prior to beginning and starting orientation. And obviously, we have ongoing testing procedures, as Zach mentioned earlier.
Thank you, Kathy. Our last question before we wrap up is from Jamie Martinez with Spotlight PA. Can you talk a little more about where vaccines could be coming from if the federal pharmacy program wraps up? It sounds like pharmacies that work with the long-term care facilities currently are not receiving vaccines. Is that correct? And what do long-term care facilities need to get vaccines into their facilities?
Yeah, thanks, Jamie. And I can take that first part. So as of right now, the Department of Health's plan that was announced 2 weeks ago says that the federal government will be sending doses of the COVID-19 vaccine to essentially what I'll call 3 wholesalers who can then distribute it to the pharmacies on the ground that have been approved to work with some of our members, be it a nursing home, a personal care home, or assisted living community. Now, unfortunately, we are still hearing examples where these pharmacies are not being approved quickly enough or are just not receiving enough of the vaccine. That's troubling. Certainly the acceleration of this program or of the vaccine rollout has been welcome news over the last few weeks, but we need to make sure that any pharmacy that is able to receive the vaccine and any pharmacy that's able to vaccinate our staff and our residents on a continued basis is able to do that. Kathy, do you have anything to add?
I would just like to add that it was challenging in the beginning. Not all 8 of our homes were on the initial list to have received the vaccine via the federal program. It took a lot of calls, weekly emails, petitioning. So we went ahead and began to work with additional resources from the city of Philadelphia. Some of our, again, the RRHCP teams from Jefferson Hospital supported us as well. We just continued, we knew how important it was, and we continued any outreach that we could. We used our pharmacy provider as well. It just wasn't at the pace at which, you know, we were hoping it was going to be that early on. But I think, again, at this point, using every resource we can, and to Zach's point, community and advocates, and making it a little easier for the pharmacies in which to purchase and support us would be great.
Yeah, and I think Jamie's second question was, what do long-term care providers need to do to get the vaccines into their facilities? For those providers who may be members of PHCA or may not be members of PHCA and you're having questions about this, reach out to your existing pharmacy partner, those relationships that you have, and ensure that they're on the list to receive the vaccine so that you can get it as soon as they get an allocation.
Kathy, Zach, thank you for your time today. There are some additional questions that did come through. We will follow up with those that provided those. If you have additional questions after the conclusion of this event, feel free to reach back out and share those with us. And we'll be following up with a press conference or the press release shortly that includes a video, this video recording from our event. Thank you all for joining us. Kathy and Zach, thank you again for your time.
Thank you.
Thanks, everyone.